I was in academia at Wake Forest University. I was kind of doing the usual process that you go through to become a professor, and started working on materials, biomaterials, specific for different types of injuries. And at that time, in the Iraq War and Afghanistan wars were, you know, pretty significant, and the Department of Defense was spending a lot of money on really complicated problems. And so one of the problems we were working on was non-compressible hemorrhage. We were using a lot of different material systems, and we started using this material called keratin. Found some really interesting properties with it. Filed a bunch of patents, and then at some point, the university's tech transfer office said, we've spent a lot of money on these patents. You need to go start a company. So we did that, and the concept was always that it was platform technology, and as we would get things mature enough, we would spin them out into separate companies. And so Caravet Bio is actually the third company that Carinetics has spun off. The first was a company called Carafast, and they did research tools, and we ended up selling that to a British company called Absolute Antibody. And then we spun off a cosmetic company, which became Virtue Labs, and they're doing fantastic. Over 50 million in sales over this last year, and doing very well. The actress Jennifer Gardner is a spokesperson for that company. And then we have on the human side, we have two products that are through the FDA and in the market. And one is a wound product. And in talking with colleagues and about wound care in the veterinary industry, it's there's options, but there's some gaps. We think there's an opportunity here to really get at something that there's not a lot of other options in the market for, and that's removing the cone from clinical practice. So we have a wound care product that also deters licking, and we found both with our clinical studies and with a sizable amount of other animals that we've tested through, I'll call it friends and family, but a lot of vet practices as well, and different size practices, from aggregators all the way down to kind of local practice owners. We found that the product will speed wound healing, which was the goal, but also will deter licking to the point where you can send the animal home without a cone. And let's be honest, everybody hates the cone. It makes an impact to the animal pet parent bond. It's a cost center